on the board for the opportunity to present our Irish experience of developing a new national training curriculum. So just in terms of a little bit of background, as most of you are aware, Ireland is quite considerably smaller than the US. There are 3 Irish training sites, Dublin, Galway and Cork, which you'll just see in a second again, I'd say there, just, which are all overseen by the Faculty of Radiologists based in Dublin, which was quite advantageous to us when it came to redeveloping a national programme. It was easy to get involvement from stakeholders at all of these sites, only 3 different centres, and different from the American model of being based perhaps in one site for the duration of residency. Our trainees will rotate through all sites, so it's important that there's, I suppose, consistency of standards and content across the board. Lovely, thanks. Yeah, so again, in terms of the background, this is pretty familiar to everybody, really, no matter where you've been based. Radiation oncology has changed a lot in the last kind of 10, 15 years, huge technological advancements. Back in 2010, we had 1 training site, which is St. Luke's Hospital in Dublin, and since then, St. Luke's expanded to create 2 satellite units based on site with 2 tertiary hospitals in Dublin, so that gives 3 sites in Dublin, and trainees began rotating to our other 2 sites at Cork and Galway around the same time. So from 2010 to 2022, we've gone from 1 training site to trainees based across 3 or 5, whichever way you look at it, across the country. We've gone from 12 trainees to 22, 8 LINACs and USA training centres versus 22 as well. And we've gone from a 2D, 3D era to now routine use of VMAT, IGRT, stereotactic treatments now being rolled out across the country. So very much a transformed landscape, but yet our training curriculum was based on 2010 levels of practice. So as a result, we felt it was necessary to update that. So we used the 6 steps method of grant to achieve this. Some of these are self-explanatory. The purpose of the curriculum is simply to train doctors to become consultant radiation oncologists in the future. Evaluation of the curriculum, again, fairly self-explanatory, trainee and trainer feedback, and also external evaluation in the format of the Medical Council of Ireland to oversee all training of doctors in Ireland. I'll go through the other steps of this now. So the needs assessment, we've already really spoken about the main aspect of that, which was, as I say, there have been quite significant changes in the radiation oncology landscape since the curriculum had been dealt with previously in 2010. But in addition, there were comparative and legislative needs. Our trainees usually on completion of their residency would work abroad, at least temporarily, to obtain specialist skills in the form of a fellowship. And what we wanted was to be sure that the skills and content that was being delivered in the radiation oncology training in Ireland would fit in with those seen in those other countries, for example, US, Canada, Europe, Australia, UK. In addition, as I said, the Irish Medical Council oversees all medical training in the country, so they accredit training schemes periodically. And we wanted to ensure that our scheme would meet the standards that the Medical Council expects. So we formed a committee based on or involving trainers, trainees, and faculty representatives. You'll be somewhat familiar perhaps with the figure on the right there. This is very similar to the CanMed's framework from Canada. This is the Medical Council's 8 domains of good clinical practice, with patient safety and quality of patient care at the centre of it. Previously, our curriculum would largely been dealt with clinical skills, so largely on radiation oncology content, specific clinical knowledge was required. But the other domains were less covered, and we wanted to formally introduce a way that these would be also encompassed within the training curriculum. So with that in mind, human factors and healthcare courses were implemented to cover domains such as related to patients, communication, professionalism. Problem-based learning and audit modules were also introduced for the medical scholarship, and the National Cancer Control Programme of Ireland became involved through links with faculty to allow trainees to work on guideline writing, evidence synthesis for national guidelines in the area. And this is how we've organised the curriculum. So it's an overlap between the modular and spiral design, in that trainees will undergo multiple modules on the way through training, starting in the early years with the common issues such as breast cancer, prostate cancer, palliative treatments, rotating through all the other major sites along their 5 years of training, with the focus in the later years on the advanced skills and techniques. And in terms of skill set, it would be expected the trainees will start out with an understanding of your simple direct fields, APPA, etc., for emergency situations, develop skills then in VMAT, etc., SABR, brachytherapy on the way through. So developing skill set alongside obtaining new clinical information. And there's examinations on the way through, which was touched on in a minute there, years 1 and year 4. In terms of the absolute content of the curriculum, then this was largely based then on reviewing other curricula worldwide, again, to ensure consistency of standards between what trainees in Ireland are learning and what trainees abroad will learn, which will be helpful when, again, when trainees finish training in Ireland and move abroad, they'll be able to quite seamlessly fit into training in, as you can see, North America, UK, Australia, New Zealand, Europe. And in terms of the experience, there is an objective measurement in the form of the FF4 RCSI examinations in year 1 and year 4. Part 1 of that is shared with the UK's clinical oncology trainees, and part 2 is a direct examination from the RCSI in Ireland leading to that qualification. And as well as that objective kind of external validation of the content scheme and the education received by the trainees, these workplace-based assessments are more there to help trainees along the way. And these are essentially kind of a work in progress being implemented at the moment, whereby there's direct observation of radiotherapy planning skills, formal case-based discussions, and mini clinical evaluation exercises. So these are all new kind of models which are being introduced into the scheme. So ultimately, what's ended up happening is we've updated the curriculum to reflect modern practice of radiation oncology in Ireland and worldwide. The assessment criteria are more detailed than previous, hopefully in a helpful manner, meanwhile maintaining the pathway to the objective FF4 or CSI qualification, and we based it on both local and international standards. And so with that, I'd like to thank all the other members of the committee involved in redeveloping the scheme, in particular Nathaniel Opentagny, was National Training Coordinator, really led and oversaw this development. And so thank you all for your attention, and again for the opportunity to present this morning.